With school out and students away from access to school counselors, the state is focusing on mental health and suicide prevention by expanding its crisis resource centers across Georgia. Atlanta Bureau Chief Archis Seshadri has more.
There are more than a dozen crisis centers around the state of Georgia, as well as other additional units, including those in Augusta, Columbus, and Savannah. These cost about $10 million per unit to run. And at these centers, they have mobile dispatch centers where people are trained to go to someone's house in case of situations where someone's not taking their meds or they're hallucinating, but they're also able to bring people in case they have some sort of mental health episode.
Talk to your child, let your child know that it's okay not to be okay. Encourage your child to be open, to talk about their concerns, their troubles. And I also think it's important that we let our children know about 988 and that resource, so that if they don't feel comfortable talking to a parent or a loved one, they know that they can reach out completely anonymous, text, chat to 988 24 hours a day.
Data from the CDC shows more than 1,600 Georgians took their own lives back in 2023, and 2/3 of suicides were due to firearms. According to the American Foundation for Suicide Prevention, suicide is the 10th leading cause of death in Georgia, and it is the second leading cause of death for 25 to 34-year-olds in the state. State Commissioner Kevin Tanner with the Georgia Department of Behavioral Health and Developmental Disabilities says the Suicide Crisis Hotline receives 20,000 calls a month alone, and 10% of those calls are children under the age of 18.
There's a lot of services we can offer, but it's hard to fix a dysfunctional home environment, and unfortunately we have a lot of children who find themselves in that type of environment. Well, I think it's important to have those good, strong family connections and to have that unconditional love within that home.
Tanner says a majority of those calls are between the ages of 12 and 18, and says those typically come from families that struggle with mental health. Experts say signs of mental health concerns can be mood swings, isolated behavior, or a change in eating habits. And some of those ways to reduce those risks include reducing screen time and increasing outdoor activities. Reporting in Atlanta, Archit Seshadri, Atlanta Bureau Chief.